What do you think is, and it's probably not as easy as one thing, but the most important things a bodybuilder can do to maintain his health in the, you know, in light of everything he does to be as competitive as possible?
You know what? Bodybuilders have taught me so much. I just hate the cultural aspect of it, in which, you know, what happens. But I have learned so much from them because they have taught me so that would never be on books. Because, you know, if you guys keep it all together there.
Right.
I will say this, but for health purposes, I think if I was going to choose, I would say heart and kidneys. And
Not even liver.
You know what? It's kind of funny that you say that. You might assume because what they do is the liver, but
I would assume liver just for everybody.
you asked me specific for bodybuilders.
Yeah, right.
So I'm gonna go after 23 years in the competition. Okay, think what is the number one drug used to get caught to get eliminate water?
With the diuretics.
That's right. So I have a lot of bodybuilders that will come with blood pressures out of the whack. Now, they come and that affects their heart. Now, to be honest, in 22 years, I only see 2 guys in which I saw a true liver problem.
Mm-hmm.
All of them get liver enzyme elevation, but that's because you're using supplements, okay?
Mm-hmm.
Now, the supplements, though, induce liver elevation because the body has to clean it. But if I go work out and lift weights, I measure your liver enzyme, they're going to be sky high.
Right.
Okay? So, is it the workout plus the supplements,
right,
or is it only the supplements? And I will say this: unless I see enzymes that are 4 times the levels that are normal, I never had any. I cannot tell you. I had only 2 people that were absolutely, and they developed capsular pain, but they had other issues.
Right.
You know, they were using supplements,
Right.
but they were doing other things that would affect the liver. For example, and I think the main reason why one guy was doing was he was using pain medications.
Right.
So that did that. But they always have people here because the HDL go really low,
Right.
and I had the lowest level was 2 that I've
Wow.
seen so far.
And you think that those numbers are really telling? That
You talking about cholesterol?
Yeah.
I don't believe on cholesterol.
no.
For me, cholesterol is bullshit.
Yeah.
So I mean, think about it. 50% of your hormones are made out of cholesterol.
Right.
Vitamin D is made out of cholesterol. Okay, my levels of anything that is testosterone, all that stuff is going to go up. So we treat cholesterol as it's a marker for heart disease. Absolutely false. Actually, if you look at the numbers, you know, when you look at the statins, all of the lower mortality they always use something called relative risk. Relative risk is this is funny. You're gonna laugh, but if I have 100 people, right?
Yeah.
And 2 had a heart attack,
Yeah.
and I had 100 people that were taking statin, and 1 had a heart attack. Is that impressive? No, but relative risk is 50% because
Wow.
so it's 50%. You see what I'm talking about?
That's how that works.
That's how they do. So statistics do wonder for those drugs.
But in reality, people have been taking up the statin drugs, all these cholesterol-lowering medications now it's been a while.
And there's no
And there's no reduction in
heart
the incidence of heart disease or heart attack, right?
Absolutely bullshit. I agree with you. I don't want to argue with you. The only thing that statins will do, it lowers CRP. You have shown to lower CRP, and it's a marker for, for true inflammation. Now, I never written a prescription starting a medication here with statins, but if I have people that are taking it, they want to do it, I'll do it. I will say this: if you have a plaque that rupture, have been shown to actually do help you, but otherwise, I will never do it. Never. I will say.
So what is the enemy? Is it oxidation? Is stress?
You know what?
Manny,
I want to teach you something. Let's suppose that you come here and you smoke.
Yep.
Okay. You have hypertension or high elevated blood pressure.
Yep.
You have a history of MI, so you already have one. Okay. You have family history. And I have this guy in the hospital, right? Oh, and this guy have high cholesterol, right? Mm-hmm. And I have the next guy that had none of this, and is in the hospital because he had an MI, but I have high levels of this. which one of these two is most predictable you coming back with a heart attack and being dead?
The insulin, yeah, because the sugar, right? Because of what it does to
Insulin is not the sugar, it's the insulin levels. Because, for example, I want to give you an example of cases. Because when you start seeing, it's funny when people, I train 10,000 athletes. No, I do see patients, all kind of different patients. I can have an insulin level normal on a person. It says it depends on the lab, but usually it's between 5 to 9 starting point, 230. Okay. Absolutely extremely high, that you should never have that. Some labs use 25, okay? But I'm gonna make that 30. Now, when you see a person with a level of 25 and up, between 20 and 25, they're making too much insulin. That means, for you and I, we need 1 insulin for 10 sugars. That person might need 5 insulins for 10 sugars. Okay, now.
Because their sensitivity's poor.
Because it's very poor, so the insulin has to be made more, so you can do it. Now, I also have patients that they go, and you go, oh man, they have 10 insulin levels too. Oh man, that person is perfect. No. Most people that come and I catch it at that level, they're really skinny, and you go, what's going on? I used to say, what the hell is going on? This person eats shit. Well, what happens is, what's happening to the pancreas?
Just not producing any insulin.
And then 2 years later, these people come back and they are diabetic. So there's 2 windows, right? So you gotta be very careful. I would say if I have a predicted value of something that will tell me that person is gonna have a heart attack, I would say insulin levels. Now, if you look at the literature, who has the most heart attacks? People with diabetes.
Right.
By far.
But is it because the insulin itself causes damage? Or is
I think so, yes. Your question is it the glucose first,
right,
or the chicken or the egg?
Right.
I think it's a component of both, because glucose actually causes H factor, okay, H-related damage, okay, and insulin also actually causes inflammation by inducing other things happening. So yes, I think it's both. Now, like I said, insulin, not the sugar, predicted the death of those patients. So the sugars are already high, but insulin is way higher. Now, one thing is, has any diabetic drug reduced mortality?
I don't think so, man.
There's your answer. Got it? You
Because
got
the
control.
insulin is still high, so it's...
Doesn't matter. You cannot
So even though you're
actually,
reducing the sugar...
every oral medication, blood glucophage increases mortality. Read it. Every single one of them increases death.
Even though it gets the glucose under control.
Even though the glucose is under control, all of them increases death.
Right.
Very interesting,
Okay,
isn't
that
it?
makes sense,
The
yeah.
glucophage does.
No, I say increase mortality.
The
Death
glucophage does not increase mortality.
doesn't increase mortality. I have no seen studies.
What is it supposed to do? Is it supposed to sensitize insulin receptors? What does it do?
Actually, you know what? Glucophage is one of the oldest drugs ever. We really still don't know how it really works, but it's supposed to really induce insulin sensitivity by making the receptor more higher affinity for insulin. Now we have drugs now that induce insulin release. Okay, I would never take that. Now we have drugs that work on the kidney, like Invokana or Farxiga. I don't know if you guys heard of this ones. Okay, Invokana or Farxiga, we have 2 receptors, one on the intestines and one on the kidneys, in which we reabsorb sugar. Okay, now this is called TC2. Okay, that's what the receptor is called. Okay, TC1 is in the intestine, TC2 or vice versa, I can't remember. Well, this is a great drug because you will pee sugar like a niño. So you actually eat your food and you pee the sugar out. Does it help you lose weight? Absolutely. Why? Because you're peeing the sugar out.
Right.
You can use it for energy. Average weight loss is pretty nice. Now, this is fairly new, so we don't know nothing about it yet long term. But it's pretty cool. Now, what happens to these people that urinate sugar all the time? They usually get yeast infections. Okay, if you're a woman, you usually tend to get, if you don't keep it clean. So that'll answer your question. Now, this is a very safe drug. I looked at the data on this drug because no drugs is clean. This is one of the few drugs that are actually clean.
But drugs aside, what's the best thing a person could do?
Well, absolutely diet.
Diet.
Absolutely.
Clean diet. Depending how you define clean.
Diet for me is dependent on the heart. It depends on the condition of the state of that person.
Right.
For example, I cannot tell a Japanese not to eat rice here because they're gonna say, "Screw you, I'm leaving." Okay, so I have to look at, race plays an important deal on weight loss. For example, a lot of bodybuilders black bodybuilders use oatmeal all the time. Why? Why do they use oatmeal? Okay, because Joe Blow told us to use oatmeal. Well, if you look at bodybuilders, they should actually, black bodybuilders should eat more rice because they will retain less water. Also, some black bodybuilders also have a allergy to foods, and that uses water retention, but they don't know that. So sometimes I just eliminate oatmeal and I'm sorry, oh, that was 10 pounds of water. Well, because they have inflammation brings water to the area,
Right.
and I look like a genius, but I didn't do anything. I just took away the food allergy.